Today we're going to talk about how preventative diabetes education can help reduce overall healthcare costs. So first we see type 2 and type 1 diabetes in this figure. So type 1 diabetes is an autoimmune disorder where the body does not make enough insulin. There is actually no known way to prevent it. So type 2 diabetes is where the body cannot use insulin properly, and most cases actually can be prevented. The CDC estimates that about 21% of the population actually has diabetes, affecting about 30 million Americans. An estimated 15 million of these cases are undiagnosed. They also estimate that about 35% of the population has prediabetes. Gestational diabetes mellitus, or GDM, affects about 10% of pregnancies in the United States annually. And this diagnosis then puts these women at risk for type 2 diabetes. So preventative education can lower these risk factors. And the main risk factors are obesity and physical inactivity. So with proper education, people with prediabetes can lower the risk of this progression to type 2 diabetes. And the likelihood of getting diabetes type 2 post-gestational diabetes is up to about 60% within 5 to 10 years of the diagnosis. So this education can help these women understand the risk and help them understand that they can lower their risk factors. So in Tang's article, we see that with education and support, we saw a 17% reduction in diagnoses of type 2 diabetes with women that had previously had gestational diabetes. So this can lower healthcare costs in the long run. So we see lowered rates of disease progression resulting in a few things. Lowered physician and emergency room visits, lowered overnight hospital stays, and lowered pharmacotherapy costs. In 2017, total costs were estimated at about $237 billion, with 20% of that being hospitalizations. A fractional improvement in this could reduce these costs significantly. And one of these articles also discussed had a quote by Stephen Wolfe that said between 2005 and 2030, the number of individuals with chronic disease is predicted to increase from 133 million to 171 million. This will increase costs significantly. However, if we can emphasize and improve this education now to lower risk factors and future diagnoses, we can hopefully lower this predicted number, we can lower costs, and we can improve quality of life for Americans.